You're tuned in to Dr. Tim's Pain-Free Podcast, educating the world about living a pain-free life. Find all our episodes on iTunes, Stitcher, Facebook, YouTube, or wherever you get your podcasts.
Hello, everybody. Welcome back to Dr. Tim's Pain-Free Podcast. Excited to be here for episode number 2.
That's right. Lots of good things we're going to go over today.
Yeah, first we want to thank you guys for watching episode 1. We appreciate all the help. We appreciate you sharing the word. Appreciate you sharing us on social media. We're going to learn a lot of good things today, too.
That's right.
So, we want to talk a little bit about America's healthcare crisis today. And one way we want to introduce that is by talking about a study that happened in 2013. Why don't you tell us about that, Dr. Tim?
That's right. Back in 2013, there was a study done with the United States and 16 other countries that were considered our peers. And they're actually the wealthiest countries in the world, the top 17 wealthiest countries. So it's not like we were comparing the United States to third world countries. They were all peers with us. And several categories were looked at that included diseases and injuries and behavior over an entire lifespan. And in these particular categories, some of the most important, the category of being overweight, the category of body mass index, which is your height to weight ratio, category of diabetes, infant mortality, and probability of dying between the ages of 15 and 50.
And so we're the greatest country in the world, right? So I'm sure we were number 1.
Yeah, well, actually, back up a little bit. We were ranked number 17th in all 5 of those categories amongst the top 17 wealthiest countries in the world.
So that brings us to a healthcare crisis.
That's right. We're in one.
Yeah. So today on today's show, we're going to talk about a couple different things. We're going to consider why it's a crisis, and then we're going to look at how we got here in this place. And then lastly, we're going to talk about what can we do to get out of it.
That's right. That's the good news. There is a solution.
Yeah, so stay tuned. We got a lot of great stuff. We're going to go over some mind-blowing stats. We got a lot of great things for today's show. So thanks for joining us on Dr. Tim's Pain-Free Podcast.
Thanks for joining us on Dr. Tim's Pain-Free Podcast. Help us spread the word by sharing this show with your friends and family and posting to your social media. Now back to the show.
Welcome back, everybody, here on Dr. Tim's Pain-Free Podcast. Today we're talking about healthcare crisis in America. We're going to get into some specifics about the opioid crisis. But we want to do a little bit of background and why are we considered to be in crisis at this point, Dr. Tim?
Well, the reason we're in a crisis right now is because the entire system is actually kind of directed and started with the wrong goal in mind, and that was that we have a symptom-based system that we operate under right now. And so a symptom-based system is, what do? You have a symptom and you go to the doctor. That's the only time we really go to the doctor is when we're sick, right?
Yeah.
And so if you look at the commercials on television, they're all symptom-based. If you have this, this, and this, then you need a pill for it. If you go to the drugstore on your own and just roam the aisles, you'll see that all of the aisles are labeled according to the symptoms. You got the cough, the cold and flu, the allergy sections of the medication. And so we're thinking in our mind, symptom equals a pill, and we're never really thinking about what is causing those symptoms and getting back to the beginning of it. So, what's interesting is the study that came out in 2000. I'm going to tell you about this study. There's going to be lots of stats on today's podcast, and so I'm going to use my cheat notes here, so forgive me for that. But Barbara Starfield, she's an MD, she has a master's in public health, and she's actually was the department head of health policy and management at Johns Hopkins University.
Very prestigious.
That's right. She published an article in the Journal of the American Medical Association in July of 2000 on the effectiveness of our healthcare system. And what she determined through all of her research in 2000 was that the third leading cause of death in the United States behind cancer and heart disease was related to medical treatment.
Medical treatment.
So going to the doctor to get help is what's causing that many deaths. And in 2000 there was over 250,000 Americans died. Were killed because of medical errors. And the categories she looked at were mainly interactions of prescription drugs that were actually taken properly and as prescribed, hospital-caused infections, errors committed by medical staff, unnecessary surgeries, and medications prescribed in error. And so all that added together, and 250,000 deaths later, it's the number 3 cause of death in the United States in 2000.
It's unbelievable. And those things that you mentioned there, the interactions of drugs taken properly.
That's right.
So that's what's prescribed to them ends up killing them.
Yep, they were prescribed the medication and they took it as directed, and they had some sort of allergic reaction or interaction, or became addicted, or whatever the case may be. And what's interesting about that is, I'll jump ahead here.
This is a hard stat to nail down, isn't it?
It is a hard stat to nail down, because in 2016, the same British medical journal came out with a follow-up to that study that Dr. Barbara Starfield did, and they claimed that by 2016 the estimates had increased by 25,000 Americans per year. So in that 16-year span, the number actually is closer to 650,000 deaths due to medical errors. And what's interesting is this number is still grossly underreported, because when you have a situation where someone's going in for surgery and they die of a heart attack while on the operating table, or they die of a stroke, then most of the time the hospital doesn't say cause of death was a surgery that caused a stroke. No, they say cause of death is a stroke, or cause of death is a surgery. So those numbers are pulled out of the equation. So we have 650,000 deaths by 2016 that were specifically related to the medical treatment, not the in-the-moment cause of death being the heart attack or the stroke. Does that make sense?
Yeah, absolutely. Wasn't Barbara Starfield even an example?
She was, yeah. The lady who did the research originally back in 2000, she died, and on her death certificate it said she drowned. But her husband, knowing what he knew and what she had been through and all the research she had done, he actually had an autopsy, and the autopsy record showed that a cerebral hemorrhage is actually what occurred right prior to drowning, and was probably the real cause of death, because when you're bleeding in your brain, and she happened to be on blood thinners and aspirin at the time, so we know that there's a link there, that it caused her to get water in her lungs and die, and the cause of death is now drowning, when we know that's not the truth.
Yeah. So it's symptom-based. We know there's a symptom, and in America, we've got a drug for that.
That's right. Yep.
If you have a second symptom, we got a drug for that.
That's right. And the interesting thing is, if those two drugs interact improperly and cause a third symptom, good news. There's a drug for that.
There's a drug for that. Yeah.
That's
so
right.
The symptom equals a pill.
That's
basically.
right.
Okay.
And the proof is that we take about 75% of the world's medication, but the United States only makes up 5%, actually less than 5% of the population of the planet. And so you're talking about 5% of the planet taking 75% of the medication. And what's interesting enough about this is we don't rank very highly. We're 17th. In another study, according to the World Health Organization, we rank 37th about how healthy our people are. And so, if you could make the argument, yeah, well, we rank number one, and no, we're number 37th, and we're number one in medication taken by a mile. The other 36 countries that rank better than us, according to the World Health Organization, they all take less than all the medication we take combined, all of those countries.
Yeah, so drugs are not making us healthy.
That's right. We take 75% of the world's medication, and that gets us into, well, what's the number two reason why a person would go to the hospital? Do you know what it is?
The symptom?
Yeah. What gets you to the hospital?
Pain?
Yeah, the pain. Back pain.
Back pain.
Number two reason to go to the hospital. Second to being born. That's the number one reason why people go to the hospital. They're born. The second one is they have back pain or some complications from a degenerative process in their back. And you know what the number one prescribed drug is for the diagnosis of back pain?
What is it?
It's an opioid.
Opioids. Okay.
Yep.
And we're going to be talking about the opioid crisis. Obviously, we're in a crisis, and the way we prove that is with more stats. So
That's
we
right.
got some stats here.
That's
so we
right.
got some. We're going to play Jeopardy. Okay.
Yep.
So we're going to put up a stat here, a number. 650,000. What does this number represent, Dr. Tim?
650,000 is the number of prescriptions of opioids.
650,000 opioid prescriptions a year in America.
No, not a year. 650,000 a day.
650,000 prescriptions are written for opioids every single day.
Every single day in this country, 650,000 prescriptions for opioids.
That seems like it adds up to more people.
That's right.
More than we have people.
You know, in some states, the research shows that, for instance, the state of Alabama, for every 100 people in the population, there's 120 prescriptions written for opioids. Now, that doesn't mean everyone's on an opioid. It means that a smaller percentage are taking multiple prescriptions every single year for it.
Yeah, like 60 out of 100 take 2 prescriptions, give you 120 out of
That's
100
right.
or whatever. Wow, that's incredible. Give me another stat right
Okay,
here.
here's the next one. 21,170.
What does this represent?
This represents the number of babies born addicted to opioids per year in our
This
country.
is per year.
Per year.
So that means about 30, 35, what is that, 60?
Yeah.
55, 60?
Right, just under 60 babies born per day,
day.
in our country are going through withdrawals the moment they're born because their mom was addicted to an opioid.
I think we're proving this is a crisis. Give me another stat here.
All right, 64,000.
64,000.
Yeah, any ideas on what that number is?
How much you're paying me for this podcast?
No, I'm not paying you 64,000. That number actually, in the form of a question, is how many people died from overdoses in 2016 of opioids?
People died in America
Yep.
in 2016, and I'm sure the numbers increased.
Yeah, the numbers are
The last
increasing.
numbers.
I mean, that's like 1 every 12 minutes die from an overdose of
Wow.
opioids in our country.
Yeah, definitely crisis. You got another stat?
No, that's it.
Okay. Well, I think we've proved that this is in a crisis. So we need to talk about how we got this way. So let's do that next on Dr. Tim's Pain Free Podcast.
Thank you for joining us on Dr. Tim's Pain Free Podcast. As a reminder, this podcast is not intended to diagnose or treat any medical conditions.
Welcome back to Dr. Tim's Pain Free Podcast. We're talking about the health crisis and the healthcare crisis in America. We're talking a little bit about the opioid crisis here in America. So tell me, Dr. Tim, what is an opioid?
Opioids are a class of medications that include painkillers, narcotic painkillers, like the hydrocodone, which is a generic term for like Vicodin, Loratab, Lorcet, those things. There's also oxycodone is a category, and the brand names of that are OxyContin, Percodan, Percocet. Some familiar names you've probably heard of if you've ever been on a painkiller. Morphine, codeine, and then there's some synthetics as well that are like fentanyl or carfentanil. You hear that in the news when you talk about the drugs that are coming into our country across the border, or however they're getting into our country. They're the precursor to heroin. And that's what it is. Heroin is actually an opioid too. Anything derived from opium, the poppy seed, is considered an opioid, and they're very addicting. And they
Incredibly powerful.
Incredibly powerful. They kill all kinds of pain. So that's kind of what they do, and they're very addicting.
Okay, now let's talk about how we got in this big mess with opioids.
Well, I get most of my stats that you've heard already today from the little Jeopardy game we played from Dr. John Rosa. And Dr. John Rosa is a surrogate on the White House committee, as well as a state and national consultant on the opioid task force. And he's in Washington. He owns 14 public clinics that are considered physical medicine clinics that he's on the ground trying to, grassroots style, change the way these drugs are prescribed. And it's already having an effect in his local area. He has one clinic that has reduced the opioid prescription writing from what it was, considering what it was, that was 100%. It's down 70% within 12 months' time. So he's out there actively trying to stir the pot and get people thinking about there's got to be a better way than all the numbers that we've seen. And he says that most people can trace the opioid crisis that we're in back to the very beginning from a memo that actually was sent to the VA, the Veterans Administration, in 1998. And what that memo said was that no soldier should return from war and have any pain. And so what happened was the big pharmaceutical companies, we call them Big Pharma, they petitioned the American Medical Association and various medical entities within the United States at the time, and they said, we need to make pain actually one of the vital signs. And the vital signs are basically your temperature, your blood pressure, your pulse rate, and your respiration rate. So those 4 things, you check those and you say, okay, is the person vital? Is he alive? Is he moving? Well, they wanted a 5th one to be pain. And so when these guys come back from war and they're getting this mandate saying, we don't want them in pain, and they're saying, well, I'm in pain because I've been through war, well, they were an easy target to write out prescriptions for these painkillers for. So that's kind of where it started. And then, the big pharma started pouring tons of money into it, because you can always follow the money.
Yeah.
And there's the train there that leads to the problem we're in. But the government actually stepped in, and they started bonusing hospitals for the numbers of prescriptions of opioids they were writing at the time. They were getting misinformation about they're not addicting, and they're doing something good for our veterans, and so they kind of jumped on board. Well, as a result of all of this advertising going in, and the ease of getting it from Big Pharma, who's out there making so much money hand over fist, it's crazy, that the results of that are now veterans in our country are 140 times more likely to be prescribed an opioid than you and I, a non-veteran.
Really?
So it's just easy for them to get. The government was pushing it. They were saying it's okay, and they were doing it. So following the war in Iraq in the early 90s, when this all started happening in the late 90s, the suicide rate of veterans from the Iraq War is over 2 times greater than the suicide rate of any prior war in our history. So
And war has been war.
War's been war. War, they've seen the same things, and I love and trust that our veterans have gone through hell and know that they've seen things that I'll never see. But when they come back and then they get on a painkiller that they suddenly can't live without, and then their suicide rate doubles. I mean,
There's something going on.
Something going on. We're in crisis for sure.
And it seems to me like the vitals, those first 4 vitals that you mentioned, are objective, right?
Definitely.
You can measure the temperature and know what it is. Anybody take it, or the other 3.
Right.
But this pain is subjective.
It is subjective. It's how you feel today on a scale of 1 to 10, and the patient says today it's a 9. I can't argue that. I know that in my mind 9 is like, well, I'm near the end here. It's like I cut off a leg or something. And a doctor I used to work with back about 20 years ago, Ronald Anderson, rest his soul now. He died in the late 90s. But one of my first jobs in this industry was working with him, and he says that even back then, this Vicodin pill was the most prescribed and the most addicting pill that you can get. So right around this same time, he was on the offense of that and saying, no, I don't want to describe that to my patients. To prescribe that to my patients. So, it's
a crisis.
It's a crisis, no doubt.
I think we've proved that it's a crisis, and the real answer is going to be in our next segment, because we got to figure out what are we going to do about this.
Yeah, there is an answer.
Yep.
We have an answer. We can help you.
Stay tuned so you can find the answer with Dr. Tim's Pain Free Podcast.
Thanks for joining us on Dr. Tim's Pain Free Podcast. Help us spread the word by sharing the show with your friends and family and posting to your social media. Now back to the show.
Welcome back to Dr. Tim's Pain Free Podcast. This is our final segment here. We're going to find out what we can do about this.
Right.
We need to figure out something. I listen to the radio and I hear advertisements for recovery clinics. And on every single one of those advertisements for somebody recovering from drugs, there's always a person on there that says, I got addicted to pain medications after my surgery.
Yep.
I think there's a direct link there, right?
Sure, there's a direct link to it, because when you come out of surgery, they want you not only to begin moving as fast as possible, but they want you to be able to do that by decreasing your pain. So they load you up on it. Well, then if you become addicted to it, then you should be off of it within a few weeks if you're doing the proper rehab and the proper functional rehabilitation. But if you skimp at that in those areas and you don't do those things, then you rely on the medication, and all of a sudden you're more reliant on it than you ever thought you could be.
And that's a bad catch-22, because then you're not in pain.
That's right.
Why do you need to do the rehab?
That's right.
Yeah, it's a bad spiral right
It
there.
is. It's a catch-22.
So tell us, how do we avoid surgeries?
Well, the way avoid surgery kind of goes back to the beginning. When we first started talking on today's podcast, we said that it's a symptom-based system. And if we would actually start looking at the body from a functional viewpoint and do functional movement type assessments on people that have an outcome assessment based model in mind, the opposite of symptom based, it's not about pain, it's about hey, you're not bending and moving and lifting properly. And we know that over time, those types of things are going to catch up to you. And you're going to develop the osteoarthritis, which leads to what? Chronic pain. And so if you let yourself get to the end and you're in that pain, then yeah, obviously there's a need for all these types of surgeries. But you know, if there's a way we can stop the person from ever even getting in that situation in the first point, then we've done our job here, you know, because there's fewer people. Another stat that I was going to mention earlier, it kind of blows my mind, but now the leading cause of death in the United States of people under the age of 50 is related directly to opioid abuse.
Man.
So if we can do something to keep us alive and keep us moving in the right direction, that's what our mission here is all about.
Yeah, so we got to avoid surgery.
Yep.
And obviously drugs in general are bad.
Sure.
We need to avoid drugs.
Well, you know, again, back to the same scenario, we wait until we have been diagnosed with diabetes and then we take insulin. We get diagnosed with having high cholesterol and we then start taking a drug to lower our cholesterol. We get diagnosed with high blood pressure and we go to the doctor and they put us on blood pressure meds. And now those meds are all good and fine and they do what they're designed to do to lower cholesterol, to lower blood pressure, to help your body function and metabolize sugar with insulin. However, very rarely do people get told they need to lose weight, they need to exercise, they need to eat more nutritionally and properly and do away with the fast food. And so from a functional standpoint, it includes a whole area of wellness that is helping prevent the problem. You know, we jokingly said if you break your ankle, don't come to our clinic. Yeah, because we're not set up for that. Medicine has its place. It'll save a life. But the overall picture of the pill making us healthy, that's been completely disproven. That's debunked. That doesn't make sense. We rank poorly and we take way too many drugs. We should rank number one.
It's basically a proactive approach versus a reactive.
That's
so
right.
All of those drugs are reacting to something that's already gotten out of hand.
That's
and
exactly
if we can
right.
get on the front side of that, we won't ever get to that point. Right?
That's
Isn't there
true.
some stat about a heart attack?
Sure. So a funny stat about the heart, not so funny, but an interesting stat I should say about a heart attack is that in 50% of the cases, the heart attack is the first symptom that a person with heart disease has, and it's the first symptom that kills them. And so when they die of a heart attack, they had no prior knowledge of that heart attack. However, if they had some sort of checkup or some sort of wellness program in mind, there's a possibility that that first heart attack at age 50 or 40 is the one that killed them, would have never happened.
So we can prevent that as well.
That's right. Symptoms are showing up near the end of the disease process. You know, when you get diagnosed with cancer, when you get told you have a few years to live usually, or fewer,
months,
you know, weeks or months. And so if we found these things quicker, then obviously we could treat them better. But if you live a healthy lifestyle, then you don't have to worry as much about those things.
Mm-hmm.
Yeah.
So we're avoiding surgeries, we're trying to avoid medications as much as we can, and then people are still in pain.
Sure.
So we have to find alternatives.
That's right. Alternatives to pain without narcotics is what we really specialize here at the clinic here in North Dallas at Trinity Integrated. You know, the various types of injections that are considered natural, using saline and a little bit of lidocaine, which has no negative reaction. It's similar to when you get your teeth, you know, worked on at the dentist's office and they give you a little numbing agent. The way those trigger points, we'll go into a whole nother podcast on this, but that's one of the main areas that we help people with is trigger points because their muscles are not working properly. A lot of the pain comes from the muscles that are reacting to the degeneration around the spine. We also have a specialist in functional movement, a guy who's working on his second master's degree here in our office. His name is Nick, and he by far is the best I've ever seen or been around when it comes to training a person on what muscles are weak and need to be strengthened, what muscles are tight and need to be loosened, how you can affect your balance, working from the feet all the way up to the top of the head, range of motion exercises, strengthening, all the functional movement stuff. And of course we have a chiropractor on staff here. The chiropractor is the one who realigns the spine and makes everything in order and in level and in in balance from side to side. There's a reason why all the sports teams you can name have a chiropractor on staff in their sports facility, because they help you perform better. And so we're talking about making the average everyday Joe who's a weekend warrior who goes out and digs in his flower bed or plays some weekend softball. They need one just as importantly as that guy whose right arm is worth $25 million a year. So there's aging and degeneration and aches and pains are no respecter of persons.
Right.
The weekend warrior, as well as the average Joe or the elite athlete, they all need some realigning. So we have a chiropractor on staff for that. We also have, to mention just well-rounded our office is, we have a manual therapist. It's like a deep tissue massage therapist that specializes in medical massage. The one thing I'll throw in about our massage therapist is that they're specifically trained in the sports injury and prenatal for the pregnant moms after their first trimester, but they also are working under the diagnosis and the treatment plan of a medical facility. So it's not like your everyday massage for just feeling good. They call that Swedish massage or effleurage. And all those terms where you just kind of feel good when you're done. Now these get in there and they work the areas that have scar tissue built up, and they help strip out that scar tissue so that you can function better. It all goes back to the function of the body.
And all those pieces integrate.
That's right.
And I think the last podcast we talked about the difference between integration and interdisciplinary.
Yep.
Is that right?
Yep. The interdisciplinary clinic or the multidisciplinary clinic is where a patient goes in and when they get to the clinic, they see that on the list there's a doctor that does surgery and a doctor that does rehab and a doctor that does injections and a doctor that is a chiropractor, and they pick one and choose it and they go that route. That's interdisciplinary. It's all under one roof, but they're not seeing all of those doctors. At our clinic, where what really makes us integrated is you get the best of all of those worlds working on the same condition on the same patient simultaneously. So our minds come together and we diagnose the problem and we shoot ideas off of each other and we say, what about this, what about that? And we look at it from different perspectives of medicine and alternative medicine and chiropractic and physical therapy, and we put it all together, and the patients really benefit from it because our stats speak for themselves. The reviews that we get online, and we're so blessed to have such a great team of doctors and staff here at Trinity Integrated that it makes it really easy when our patients love us and what we do.
Yeah, absolutely. So we encourage you to do what you can to be proactive in your health. Get ahead of the game. You don't want to wait and just be reactionary. You don't want to just be taking a pill because you got a symptom.
That's right.
We got to be proactive in our looking for and being ready to be healthy. And so we encourage you to do that. We thank you for listening. We know this is a big, important step for you to listen to this podcast, and we thank you for doing that for us. You ready to wrap it up, Dr. Tim?
That's right. We're good.
Thank you so much for being here. Please share. Let everybody know we're trying to get the word out on being healthy and having good health. So thank you so much for doing this. Find us. Where can they find us?
They can find us right here in Carrollton, Texas. We're on Hebron Parkway. You can find us on the internet at www.trinityintegratedmedical.com. This podcast can be seen on Facebook. You just have to search Facebook or YouTube. Go in the search bar and type in Dr. Tim's Pain-Free Podcast and we'll come right up.
Enjoyed it. Thanks a lot. Thank you guys for being here on Dr. Tim's Pain-Free Podcast.
We'll see you next time.
Thanks for joining us on Dr. Tim's Pain-Free Podcast. While I make every effort to broadcast correct information, I'm still learning. I will double-check all of my facts, but realize that medicine is constantly changing. One doctor may have a different way of doing things from another. I am simply presenting my views, and the opinions are solely of my own. I welcome any comments, suggestions, or correction of errors. I take no money from drug or device companies. By listening to this podcast, you agree not to use it as medical advice to treat any medical condition in either yourself or others. Please consult your own physician for any medical issues you may be having. This entire disclaimer also applies to any guests or contributors on the podcast. Under no circumstances shall Tim Usselton, D.C., or guests or contributors to this podcast, or employees, associates, or affiliates of this podcast be responsible for damages arising from the use of this podcast.